Hi everyone, it's Miss V once again, back here with your final forensics video. Wow, seems like just yesterday we were starting this online journey and now it's almost coming to an end. So if you are watching this video and you are all caught up with your assignments, kudos to you. If you're still working on them, keep going guys, I know that you can do it. So in this last unit of anthropology, we've been talking about the human skeleton and what it can help us to determine and how it's important in forensics, right? So we now know the major bones that make up a skeleton and how we can read them for knowledge on an individual's age, ancestry, sex, or height. But there's one important piece that we're kind of missing, and that's pathology. And that's what we're going to be talking about today. So bones can tell us a lot of things, right? They tell us that individual's age, their gender, different things like that, and it kind of tells us a story. And bones can tell us a lot more than just these 4 facts that we've been studying. It can also tell us, sometimes the quality of life that they had while they were alive, and it can also give us a really good hint as to how they died in some cases, right? So if you can see a skeleton and you notice that maybe a broken bone has been mended, you know that that person was given medical care and taken care of throughout their life. We can also, by different maybe breakages or conditions within the bones, see why that individual may have passed on. So let's go ahead and get started on our final topic of pathology. All right. So pathology is the study of the causes and effects of disease or injury. So pathologists are typically, people in white lab coats, studying diseases or different bodies to see how they passed on and why, and researching these things. Now, a forensic anthropologist focuses mainly on the skeleton and getting information from that skeleton. However, pathologists can look at skeletons, but they also will look at dead bodies while they're still quote unquote fresh, because they can also use different signs from a human body to determine how that person may have passed on or help to tell a story of their final moments. Now, pathologists usually determine the time of death, and this can be done most accurately if the body is found within the first 24 hours. So that doesn't happen in all cases. However, if it does, we can usually determine when it was that they passed on. And they also use certain indicators to do this, such as agar, liver, and rigor mortis. So these are terms that we're going to be learning today and focusing on. So first one we're going to be talking about is rigor mortis. So rigor kind of meaning the rigidity of the skeletal muscles after death. So you may have heard, someone say, oh, they've gone stiff as a board, like they're scared. Or that, when someone passes on, their body goes very stiff, like a board. The easiest answer to boil this down to is a biochemical chain reaction that causes all living person's muscles to move stops when someone dies. And when the reaction stops, the muscles get locked into place. So rigor mortis is kind of a gradual stage. It's a progression of events. So this usually sets in the head after 2 hours after death and slowly works down the body to the legs. So by seeing how stiff that individual is, you can sometimes guesstimate when they had passed on. So stiffness peaks around 12 hours. So this means that the body is very stiff and you have to use some pressure in order to move the limbs or anything like that. Now, after this 12-hour period, the cells of the body start to dissolve and the stiffness will slowly disappear. So stiffness completely disappears after 36 hours. So By using this, we can now have a little bit of a window, an idea to tell us when this individual may have passed on. So a body that is not stiff has probably been dead for less than 2 hours or more than 38. So this is when the stiffness, it takes effect from the 2-hour mark to the 48-hour mark. But if the body is not stiff or kind of limp, you know that it happened outside of that range of time. So this is why sometimes, in cartoons, if a little animal's pretending to play dead, you see them with their legs up in the air. And this is kind of showing you that rigor mortis, that their limbs are stuck kind of in that position. Now, there are some factors here that affect rigor mortis. It's not a hard and fast rule, or these times are not definite. So there's different things that can affect the stiffness of the body and how long that stiffness will last. So typically it has to do with temperature. Cooler temperatures are going to slow down the onset of rigor mortis. So maybe it'll take longer for that body to stiffen, and then once again, longer for it to loosen up again. And warm temperatures actually speed it up. So if you were to find a body out in the sun, it may become a lot stiffer a lot quicker. All right. Our next topic is livor mortis, which sounds very similar to rigor. So we have to kind of keep these straight in our heads. And this actually has to do with the pooling of blood in our tissues. Right? Our body is made up of blood, and that is kind of the life force. However, once we pass away, it does stop circulating and it kind of settles in our body. So when this happens, blood settles usually in the lower parts of the victim's body. So red blood cells break and release a protein called hemoglobin, which in turn will turn purple as it spills out of the cells. Wherever these pools of blood settle, the skin will take on that purple coloring. So livor mortis not only helps approximate time of death by seeing like how purple different parts of the body are turning, but it also really indicates positioning of the body within the first 10 to 15 hours. And this is what I mean. For example, if all discoloration is on the front of the body, this indicates that the person was lying down, because all of the blood is now pooling on the front where their body was laying. However, if there is discoloration on many parts of the body, this may show that a body was moved from one place or position to another because the blood had started to settle at one position and then was moved and started settling at another. So this can really help to indicate if a body was moved during a crime. Now, this lividity or this coloration usually becomes fixed after 10 to 15 hours. So after that point, if the body is moved, you won't be able to see that discoloration. Instead, you will just see the permanent purple coloring on that one side of the body that they were lying on originally. All right, and our last one here is algor mortis. And this is talking about the cooling rate of the body. So when a person is alive, the body maintains homeostasis and regulates a constant temperature, or at least it tries. So your body is always trying to keep you at a happy medium. If you get too hot, your body tries to sweat to get rid of the extra heat. And if you get too cold, your body starts to shiver, trying to generate more heat. It's always constantly watching out for you. However, after death, the body no longer can maintain its heat and it begins to cool down. So there's a little equation here called the Glaser equation that can help us to calculate how much time has passed since an individual's death by using their internal temperature. So say there's a crime scene and there's a body involved, they'll usually take the internal temperature of the body and use an equation similar to this or this one to try and get a rough idea of when that person passed away. Now, generally the body cools 1 to 1.5 degrees Fahrenheit per hour until it reaches the temperature of the surrounding area. So it's really important to remember that this is typically measured in Fahrenheit, which is an American unit, instead of Celsius, which you may see more frequently. So let's go ahead and do an example. So it says, at a crime scene, a body's internal temperature is measured to be 13.2 degrees Celsius, or 55.76 degrees Fahrenheit. Approximately how many hours have elapsed since death? So what we would do here is we would now put that into our equation here. So, and I'm going to do it with my Fahrenheit measurement. So I'm going to use 98.4 degrees Fahrenheit. And this is like the typical average body temperature in Fahrenheit, also known as 37 degrees Celsius, and subtract the internal temperature of the body that was found, so 55.76 degrees Fahrenheit. And my next step, after I actually subtract that, is to divide it by 1.5. So doing this doesn't mean an exact measurement. However, it does give you an idea that the body has been there for quite a while and that the person probably passed on about 28.5 hours ago, give or take. Now, there are also some things that may affect rigor mortis, or how fast that body cools down. Can you think of any? There's actually quite a few. Temperature of the surrounding environment is a really big one. So if I'm in a really cold area, when I pass away, my body is going to lose that heat a lot quicker than if it's in a warm and sunny area. The type of clothing on the body is also very determinant on how fast the body will cool off. So if someone is wearing lots of clothing, maybe a really warm parka, and they are in a really warm area, it's going to keep that body very warm compared to if they were wearing very little clothing and in a cold environment. The wetness of clothing can also be a big determinant. Now, have you ever jumped in a pool or ran into a lake all fully clothed? And when you come back out and the wind hits you and you get really cold, right? So if your clothing is wet, you usually actually lose your body temperature a lot quicker. Air movement is also another one, right? If you've ever walked around on a windy day, you do get a little more chilly than if it's a very still day. Layers of clothing, so that's kind of the same point as the type of clothing, as well as the size of the individual as well. So a larger individual would maintain their heat for a lot longer time than something that was a lot smaller. All right, so now that we've talked about those three factors and how they can help us to determine the time of death or the position of the body, we're going to get back into the skeletal aspect of this. So, and how our skeletal remains can help us to determine a cause of death. So, a cause of death is usually left to the pathologist to determine, but only if skeletal remains are left, an anthropologist is then consulted because they're a professional on bones. So sometimes causes of death are really obvious, such as a stab wound or bullet holes, etc. Anything really extreme on that skeleton or on that body is going to give us a good idea of why that person passed on. There can also be situations where it can be really difficult to determine that as well. Now, sometimes the murder weapon has left a distinctive mark that can be matched to the wound on a skull. This can actually be used to, make someone a suspect in a case, especially if it's a very distinctive mark made with a very distinctive tool. So investigators must be very careful to make sure that any markings were a result of the crime and did not occur before death or after death. So, for example, investigators must make sure that when they see different markings on a skeleton, that they know what happened at the crime scene. Things like a bullet wound seen in this image is very likely to have been the cause of death and happened during the crime. However, other markings such as scavenger marks left by animals are more likely to have occurred after the fact, after that person had passed away. Now, bones also tell a story of one's life, including earlier injuries, joint replacements, and also bone diseases such as osteoporosis and arthritis. So it can tell us a little bit about how that person lived while they were alive. One example is by looking at the quality of the bones. And if you can also usually tell if a bone has been mended from a break. In this picture right here is showing a very poorly healed bone. So this individual didn't get proper medical attention, or it's possible that it is a skeleton from hundreds and hundreds of years ago and perhaps didn't have the proper care or knowledge on how to take care of that broken bone. Another example over here is a photo of a hip replacement. So you can see how the top portion of this bone has been replaced with a very very similar metal replica. So you can tell that this person had to get a hip replacement sometime in their life. This picture right here is showing osteoporosis, which is a bone degenerative disease that is common among people today. And it's actually showing you how the matrices of the bone have become a lot weaker. Usually this is a lot more densely packed, but we can see that this bone has started to wear away and that structural matrix that usually makes it very strong has started to weaken. Now, your bones can not just tell you about how the person lived, but also how they may have passed on. So if we see different wounds on these bones, we can assume that different weapons or different incidents happened to that individual. For example, this image here is showing a very sharp, deep cut in the bone. And this could show that a sharp force such as a knife or other sharp object was used. Another example is of blunt force. Usually this causes a very large or circular indent with cracks around it. And this is showing that a blunt object such as a hammer or maybe a bat was used and can also indicate why that individual may have passed on. Another example is ballistic or a bullet wound, which makes a very characteristic hole in the skeleton. All right, two more examples. So this one here is showing you some gnawing that may have happened from an animal. So animals tend to chew on the ends of bones, and the pointed parts of their teeth will leave distinct damage to the bone surfaces. So if a body was discovered and had been outside for quite a while, these may have shown that an animal had been near it. Now, this interesting image here shows something called periostitis, and this is kind of indicating an infection that occurred near the bone. So just like any wound, fractures that are not properly taken care of become infected. And when the membrane that covers the surface of this bone becomes infected, it causes a lot of damage on the soft tissue. So this is kind of showing almost like a wearing away of that bone. It kind of looks like a hardwood floor, kind of. And so once again, it's called periostitis. All right, everybody. I hope that you learned a lot from this video, and it will help you with our assignment that's going to come out next week. It is a little bit larger. However, it is a virtual lab that you'll be doing, and you'll be given the entire week to work on it. So please make sure to email me if you have any questions, comments, concerns, and I will talk to you next week. Enjoy your weekend, everybody. Bye-bye.